Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert. I am here today with my very much French-speaking co-host, Dr. Millicent Rovelo. Bonjour.
Bonjour, merci, bienvenue.
I'm done. I'm out.
those are
like
three
right there, I'm
words I
finished.
know.
I got croissant after that and maybe omelette du fromage. How's that sound?
It's pretty good, actually.
All right, cool. We are talking about what's going to happen in Paris. We have a IMCAS preview. And IMCAS is an acronym for the big ass meeting that we are going to in Paris at the end of January. And it stands for, okay, hang on.
You got this. You got this.
We just looked it up. How could I possibly
We
forget?
didn't look it up. We knew.
No, I didn't know because I thought it was something different. But it is the International Master Course on Aging Science.
And there it is, folks.
Hold my beer. I got it. That's right.
That's what it is. It's a mouthful, but it is also...
It's like a lot of stuff now.
It's amazing. So it was started initially as a dermatology aesthetic medicine
Benjamin
conference.
Asher.
Dr. Benjamin Asher.
Who is
created it.
a dermatologist.
And he created this course for his people and anybody that was interested in doing kind of aging science. So at the time, that's anyone that's doing scientific research on how the skin and the body and the hair ages and the management of this. So Botox, fillers, lasers, all of the devices. Over time, they added the surgical specialties, mainly, plastic surgery, and they included us into this course. But this is like a monster conference. I mean, they have multiple ones throughout the year in various locations across the globe, but this is like their main hub course, and it's in Paris, and it's usually in January. And this place is amazing. I mean, you and I go to conferences around the world and here in the United States, like routinely, and they don't hold a candle to this conference. The amount of people that are there, the energy that is there, it's like nothing anybody has seen before. And because regulations are different in Europe compared to the United States, the products that they have to show, the devices they have, it's like a kid in a candy shop if you're like, poor and can't afford the candy, because in the United States, we're never going to get any of those products. So I kind of walk around being like, wah, wah.
Well, it's not never. I mean, I really thought that there was a point that we weren't going to see Motiva implants. And
True.
I've now put in 3 sets of Motiva
Right.
implants in the last 2 weeks. So I'm very pleased because, it is important for us to go there so first of all, 18,000 participants at the IMCAS meeting. Like our aesthetic meeting for the
United States,
for the ASAPS, the American Society for Aesthetic Plastic Surgeons, now known as the Aesthetic Society.
Yeah.
We might have 2,000 people.
Yeah, maybe.
Maybe if at the ASPS, the American Society for Plastic Surgeons, 4,000, 3,000, something like that, 2,500.
This is not that many plastic surgeons in
Right.
the United States, but this conference pulls plastic surgeons, dermatologists, and they say aesthetic medicine
From around
the world. And we're talking Turkey, Greece, China, Singapore, Colombia, Brazil, United States, Australia. Like they are all there, and it is a huge deal, and the energy there is incredible. So I feel so honored that I've been able to speak there the past couple of years. I know you've been going for a long time, and so we just sort of wanted
I'm very old, Millicent. That's really the bottom line. I've been around a while, and I have been going since like 2006 or 7. I mean, it's been a long time, and every year when I go there, they kind of remind me of that, and they're like, one of the founding members. I'm like, I really? I guess I was. I was kind of there, but the reality is that between Benjamin Asher and then Sebastian Garçon and Hugh, they've taken over for him to run the whole thing. It's just been, I mean, it is a beast of a meeting. It's so much fun, and I am very glad that they have continued to have us be involved in the teaching there. It's interesting. I just don't think that people don't understand like kind of what you and I do with the fellowship, with the residents, with international education. I mean, we've been in Dubai, we've been in Paris, we've been in just we've been all over the world, like doing these lectures. And so I think, just because we don't like yak about it a whole lot, it's not really like on everybody's radar screen. But how many lectures are you giving at this meeting?
I have 2 lectures and I'm moderating a third.
So you'll be on the stage for three big lectures.
Right.
And you're talking about what,
So my topic,
IMF?
so is basically the IMF, the inframammary fold, how to address and treat it in revision complex breast cases.
And we have a podcast
about that. And then also how to safely and effectively do body contouring in patients with elevated BMIs, which I thought was a uniquely American problem, but I think it's becoming kind of a worldwide issue these days. And then the panel that I'm moderating is on the management and treatment of lipedema.
I mean, those are big topics, and they're key. I have a rhinoplasty panel on the Thursday when the meeting starts, and then I have my live surgery.
That's very cool, by the way.
Oh, it's gonna be great.
BT Dubs.
Yeah, I'm very, very psyched. So the IMCAS people came and filmed an entire operation of mine, a revision rhinoplasty with a rib graft.
Like in the summer, right?
Yeah, it was in August.
Yeah.
And then they're gonna show the video that they created from the live surgery while simultaneously, probably you'll be with me if you can be, but we'll be in the cadaver lab with a dissected nose that I'm gonna dissect the day before so that I can show like what all the anatomic principles of what I did during the operation. And I think this is the way to do live surgery.
I mean, the way they do that, I've seen this several times now. Like it blows my mind, mostly from like a technical orchestrational like way they were able to coordinate this. They have all of these surgeries that they've already filmed and they have that uploaded. You're in a huge room, a big assembly room where people are watching everything. And so the feed of the live surgery is playing like kind of in real time. You have a panel of moderators there asking questions about what's happening. And then on a separate screen, you have also in real time the surgeon or whoever is doing a cadaver dissection pointing out like kind of in tandem with the surgery that's being shown. So these structures that I'm operating on right now, you can see right here, these are the, whatever we're looking at. Like it's like how they're able to coordinate that, like is incredible.
It's Sebastian and Hugh.
Yeah,
These guys this was their idea, by the way. And I think Sebastian was really sort of the spearhead for that because it doesn't make sense to wait 5 hours for somebody to like do a revision rhino or something. It's it's so hard. And I've done that.
Yeah, it's too long.
I've done that. I did revision rhinoplasty on a patient from like the Ural Mountains in Russia, in St. Petersburg. And it was a hard case. And, I'm speaking while I'm operating. They're translating it into Russian while I'm talking.
Right. It's taken a few hours.
My jokes are not hitting, which I remember very well, that my jokes did not hit. I asked for the Russians, which is
instrument.
It's an instrument. It's a forceps that we use in the U.S. I said, hey, give me the Russians. I go, hey, what do you guys call these? And they're like, we call them forceps. It was
hysterical.
Like I was like, hey, can you guys hear me in there? They're like, yeah, we got it.
You just
silence.
Not that funny,
it was like nothing was working. It was just like crickets the whole time. So this is better. They take your operation, they distill it down to 2 hours. You have a cadaver dissection. I'll be in the lab. Hopefully you'll be with me like assisting, and we'll be showing things and we'll be talking about this and we'll be making jokes that probably don't hit in French.
Don't land at all. No.
Don't land at all. And then they have a panel. And I've been on those panels where I was on the panel when Dominic Bray was doing his deep plane facelift and I was asking him questions. He was like, thank God you were asking me those questions. I was dying over there. I was like, yeah, it's really hard. Yeah. But the reality is that the participants who come, and there's like a lot of surgeons. There's like 3,000 surgeons out of the 18,000 participants, and only the surgeons can get into the surgery rooms. It's really worth it. I find those sessions to be amazing.
Yeah, I know. I was doing one last year. I was moderating a breast lift panel for the live dissection. I learned so much. I was like, oh, that's really cool. I'm gonna do that. I love what you're doing.
Yeah. You learn so much, and that's why I love this meeting. And The U.S. has nothing like it. There's no meeting that even holds a candle to it, because the truth is that the multi-specialty thing doesn't work in the U.S. People don't want to collaborate. They don't want to learn from each other. They want to, isolate and say, I'm the best. And they always talk about, like, I've got this. And in the meantime, they're photoshopping all their before and afters. Like, I'm just going to, this is for the surgeons. And I know, I'm not getting up there. I know. If we have our new artwork for our new billboard, everybody's going to love it. But I'm just going to say, if you sit there and say, I need to Photoshop this, then you need to go back to surgery school. That's all I'm going to tell you. If you can't show unphotoshopped photos on your Instagram and on your website and on your TikTok, then maybe you need to think about how you're going to get the results that you wish you had, because you cannot Photoshop your photos. And I know there are no laws against it. You do whatever you want. It's marketing. You can make things up, and we talk about it all the time, and I rail on it. I know that you have had to sit through a few rants on this podcast, Millicent, and
yes,
I appreciate that. But and thank you. But at the same time, like, if you're the surgeon that's doing the photoshopping or telling your guys, like, make it look good or whatever, maybe you need to go back to your surgery school and say, like, how can I get the results that I'm trying to create here? Because there's a way.
Right.
It can be done. I just couldn't do that. I just can't. So by going to these conferences and going and learning and seeing and pushing yourself to the next level and going to the anatomy lab and going to the courses and spending time and going to observe the people that you think are really good at this, you're going to get yourself to the next level. It is a push, and you have to do it. And I'm not saying it's easy, and I'm not saying that, like, we're not perfect at all. Not even close.
Not even close.
We have complications. We have problems.
Absolutely.
That's part of doing surgery, and your patients have to go there with you. If they want to have surgery and they want to get these results, they have to believe in you, because you'll find out how good your surgeon is when things aren't right. That's when you know if you've got the right surgeon, because they'll step up and they'll make things happen. They'll take care of it. They will be there for you. And if they're not, then you know what you've got.
1,000%. We all hate I hate complications.
How can you not?
Yeah, but you go through it with your patients, and
you do
your best for them.
But that's why you have to go to these conferences. That's why you have to learn.
That's why you have to learn. And we are so excited to go. We've given a brief preview on what we're doing. I'm doing some breast and body. You're doing the faces and the noses. And we're going to give our talks. And we're going to eat lots of croissants. And I'm going to gain 5 pounds. And then we'll come back and we'll distill everything.
But maybe you need some fat grafting. That would be the time to do it. I don't know. But maybe there's something you need.
Maybe those hip dips fixed.
Like at that's the point to do it. But yeah, no, I am very excited for it. And it's always great. I see lots of friends that I have from around the world. I mean, that's one of the greatest things about what we do. It's like, when I got to Cornell Med School, and I'll never forget this. It was when I showed up on my first clinical rotation. And, you go up on the floor and it's like, okay, you're done with pathology. You're done with all these things. And now you're on the floor and it's like, you're going to do your internal medicine rotation at New York Hospital. Like it's a big deal. So I'm there and I'm on the Upper East Side of Manhattan. Cornell Med School is not in Ithaca, despite everybody's like, how was Ithaca? I was like, I have no idea. It's freezing cold there. I'm never going there. But, the Cornell Med School is on the Upper East Side of Manhattan at New York Hospital. Now it's like New York Press is what they call it. And you get up on the floor and you've suddenly realized that your teachers are all residents. They're all other doctors who are practicing medicine. And I didn't quite put that together until I'm there. And, Gary Lamack is, one of my, guys on my rugby team teaching me how to do chest tubes, and he's going into urology and all of a sudden you realize like, oh my God, we're teachers. Like, we're not just doctors. Like, the only people that are going to teach doctors how to do this are other doctors. There are no doctor teachers.
Right.
They're only people like us that are willing to educate others and become the real physician educators of other physicians. And so from a standpoint, this kind of a meeting like an IMCAS is the ultimate exercise for me, because I'm sitting there and I'm presenting these incredible topics, and here's my live surgery, and you're bearing your soul. Oh, this didn't work out the way that I wanted, and this way I could have done this, and it would have been this way, and she looks great. The patient that I did is over the moon. In fact, I've already put her up on the Instagram. Just, I won't tell anybody which one she is. But the amount of education that you get from listening to everybody else, like it's great to teach, but I learn more at this conference than I do anywhere else. It's just you hear so many new ideas, and we're doing this, and we're trying this, and we tried this, it didn't work, and now we get this, and this is really working. And you're just like, yes, I'm going to do that. That's amazing, and that's why the surgery keeps going to a new level every year.
It's amazing, and I come back energized, excited to not even just like implement things I've learned, but just excited about my profession and what I do and the cases that I do. So yeah, definitely looking forward to it, and more to come on that one for sure.
I don't know about you, but I always like the January sales because everything's 50% off. Sold. Everything is 50% off in Paris because they're clearing out, getting ready for spring.
The designers.
Yeah, they don't do that. No, Louis Vuitton.
We don't do that.
Nope. No, that's for the other designers. But it is cool. I can always pick up
with a few things.
New shoes, new tie, something like that, because it is 50% off in January.
Yes.
It's also cold. It's not the right month to be in Paris.
One time it was in June because of COVID. So it got pushed back to, oh my gosh, that was beautiful.
Awesome. That
I
was
like,
best
can we
time.
keep doing that every year? They're like, yeah, it's a little expensive at that time of year. January, little less expensive.
Yeah, we'll be at the Palais des Congrès, which is nice. I mean, it's true. The Paris in June is
beautiful,
insane. That was really cool. Yeah. But yeah, I mean, January, like we'll deal with it. It's rainy, it's cold, but the food is still really good. The wine's amazing. We had that like caviar dinner we went to that one time. That was really good.
So good.
That was actually like
really
outstanding. Yeah, so there's that. There's that part. I don't want to discount the education, though. It's like we're there for that, but if we can get a great dinner on the circle around the Arc de Triomphe, we'll be there.
Absolutely.
Cool. Anything else about this meeting? What's gonna be the big? I'm just kind of curious. Like, okay, so like the Motiva implants made it here. There's all kinds of energy devices made here. I got my amazing ceramic scissors there. Mm-hmm. Incredible. I love those scissors.
You do.
I do. And I am speaking on that master class on facelift. Of course, it's the last lecture series right before the gala dinner.
Oh, I had that lecture once.
It's like, how are we going to get everybody to stay?
10 people in my
Masters
room.
in facelift. 4 p.m. The gala starts at like 6:30 or 7 or something. What can you do? It's all right. I'm happy to be on the Masters of Facelift because I will be speaking about endoscopic facelift combined with deep plane facelift.
Ooh, so exciting.
It is going to be cool.
I know.
Well, I think that's it. I think that's our preview. If you want to hear more about it, just check out our social media, and then also, go to the website for IMCAS. It's I think it's IMCAS Paris 2025.
Here's your Alzheimer's test again. What does it stand for?
Oh, are you really going to do this to me right now?
Yes.
You know that I am now like, closer to 60 than I am to 50.
That's what I said. It's your Alzheimer's test.
International Master Course on Aging. Skin. Science. But you know what?
Neurology
I just want to tell you something. It used to be skin. Somewhere they changed it.
Okay.
It was because it was a dermatology conference. And I think when I started it, that's why I'm like having. So you're right. Maybe I have like, I may have Alzheimer's and like I have my long-term memory, but I can't create new memories.
Probably what it is.
It's probably Alzheimer's. That's probably it.
Okay.
No, I
As our good friend Catherine says.
Okay. That was so great. We're not going to comment on that, but let's just say we have a French friend who is very French. Mm-hmm. In that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.